Did you know that your morning erection is more than just a private, fleeting moment? It's one of the most important health signals your body gives you. For many men, especially after the age of 60, these erections either become weaker, shorter, or disappear altogether. And while that might feel like an embarrassing or taboo topic, the truth is this: your morning erection is not just about sex. It's a daily check in on your cardiovascular health, your hormones, and even your psychological well-being. Ignoring it is like ignoring the check engine light in your car. Now let's get real. A lot of men chalk up changes in their erections to just getting older. But that's only part of the story. Yes, testosterone levels decline naturally with age, but morning erections rely on much more than hormones. They're a result of healthy blood flow, intact nerve signaling, and a body that's balanced between stress and rest. When that balance tips because of high blood pressure, diabetes, poor sleep, excessive stress, or even too much alcohol, those early morning erections fade. And here's the hard truth: if you're not waking up with them as often, it may be an early warning sign of heart disease or metabolic issues. In fact, erectile dysfunction often appears years before cardiovascular events like a heart attack or stroke. Think about that for a moment. Something as intimate and personal as an erection could actually save your life if you pay attention to it. But here's the flip side: when men notice changes, too many respond with shame, silence, or denial. They think it's about masculinity or performance, when in reality, it's about health and longevity. The stigma around this conversation keeps millions of men from getting help, and worse, from catching preventable diseases early. So I want to challenge you: stop seeing your morning erection as just a measure of sexual performance and start seeing it as a measure of your overall health. Let's break down the biology for a moment. During sleep, especially in REM cycles, your brain sends signals to increase blood flow to the penis. This keeps the tissue oxygenated and healthy. It's like a nightly maintenance system. When you wake up with an erection, it means your blood vessels, your nerves, and your hormones are working in harmony. But when those signals are weak or missing, it suggests that something, circulation, testosterone, or even your nervous system, is off balance. That's why urologists pay such close attention to these patterns. Now, here's where lifestyle comes into play. Men who prioritize exercise, balanced nutrition, and quality sleep are far more likely to maintain strong erections into their 60s, 70s, and beyond. Why? Because exercise improves circulation, lowers blood pressure, and increases nitric oxide, the chemical that relaxes blood vessels and makes erections possible. A Mediterranean-style diet reduces inflammation and supports vascular health. And consistent, restorative sleep helps regulate testosterone, which peaks in the morning, fueling those early erections. These are not just wellness tips. They're non-negotiable tools to protect your sexual health. But biology and lifestyle aren't the whole picture. Psychological factors matter too. Stress and anxiety can hijack erections by activating the fight or flight response, which literally pulls blood flow away from the penis and into survival mode. If your mind is constantly racing, your body will struggle to prioritize intimacy. On the flip side, when you cultivate relaxation, self-confidence, and emotional connection with your partner, you're creating the conditions for stronger, more consistent erections. This is why mindfulness practices, therapy, and open communication in relationships are as powerful as any medication. So let's flip the narrative. Weak or absent morning erections are not a reason to feel ashamed. They're a reason to take action. They're your body's way of saying, pay attention, make changes, protect yourself. The men who ignore this sign are gambling not just with their sex life, but with their heart, their brain, and their future. The men who listen, who get checked, who invest in their health, who embrace both medical support and lifestyle change, are the ones who thrive. If you're over 60 and you've noticed changes, I'm urging you: don't hide it, don't downplay it, and don't accept it as normal aging. Speak with your doctor. Get your blood sugar, cholesterol, and hormones checked. Recommit to exercise, better sleep, and a healthier diet. And remember, sexual health is whole body health. When you protect one, you strengthen the other. Your morning erection isn't just about desire, it's about survival. Ignore it, and you risk losing more than intimacy. Honor it, and you gain not only better sexual health, but a longer, healthier, and more connected life. That's not a small detail. It's one of the most powerful truths men need to hear. Here's a question most men never ask themselves. If you wouldn't ignore weak arms or weak legs, why do you ignore a weak pelvic floor? Here's the shocking truth. Your pelvic floor is one of the most powerful muscle groups in your body, directly responsible for bladder control, sexual function, and yes, strong, lasting erections. Yet most men have never even heard of training it. And when the pelvic floor weakens, the results show up where you least expect them: embarrassing leaks, weaker orgasms, and the loss of those morning erections that once felt automatic. Let's break this taboo. For decades, pelvic floor health was seen as a woman's issue. Women are taught about Kegels during pregnancy or after childbirth. Men, they're left in the dark. But here's the science. The pelvic floor is a hammock-like group of muscles at the base of your pelvis. These muscles support your bladder, bowels, and reproductive organs. When they contract, they help control urination and ejaculation. When they're strong, they boost blood flow to the penis and lock in rigidity during erections. But when they're weak, often from aging, sitting too much, obesity, or even prostate surgery, you begin to lose control. What feels like just getting older is often muscle weakness hiding in plain sight. Think about this. Men spend hours in the gym training chest, biceps, and abs to look strong, yet neglect the very muscle group that determines their sexual confidence. Isn't that backwards? A man with a strong pelvic floor not only has better erections, he often has better stamina, better bladder control, and even more satisfying orgasms. That's not vanity, that's health. So what can you do about it? First, drop the myth that nothing can be done. Too many men suffer in silence, assuming pills are their only option. But studies show that pelvic floor training can be just as effective as medication in improving erectile dysfunction. Sometimes even more so when combined with lifestyle changes. These exercises aren't complicated. They start with learning how to activate the right muscles, the same ones you'd use to stop urination midstream. Once you identify them, you can practice controlled contractions and relaxations daily. Over time, these simple movements increase blood flow, improve nerve signaling, and rebuild strength in an area most men ignore until it's too late. Now, let's address the psychology. Erectile difficulties don't just stay in the bedroom. They spill over into confidence, relationships, and even identity. When men feel like they're losing it, they may withdraw from intimacy, avoid conversations with their partners, or carry silent shame that eats away at their self-worth. But here's the empowering part: pelvic floor training puts control back in your hands. You're not waiting for a prescription. You're not passively hoping for change. You're actively rebuilding the very foundation of your sexual health. That shift from helplessness to action is transformative, and it doesn't stop at sex. Strengthening the pelvic floor also reduces urinary leakage, improves bowel control, and enhances overall core stability. Imagine going from worrying about accidents or weak erections to feeling confident, strong, and capable again. That confidence radiates into every part of your life, your posture, your relationships, your energy. Isn't that worth a few minutes of training each day? Here's the contrast I want you to see. Neglect leads to frustration, embarrassment, and slow decline. Attention leads to strength, vitality, and renewed intimacy. Which path will you choose? You wouldn't ignore your heart if it showed signs of weakness. You wouldn't ignore your vision if it started to fade. So why ignore the pelvic floor, a muscle group that impacts both your health and your identity as a man? The men who dismiss pelvic floor training as unnecessary will face preventable struggles. The men who embrace it will rediscover control over their bodies, their confidence, and their connections with their partners. That's not hype. That's medical science backed by decades of research. So let me leave you with this. Your pelvic floor is the hidden powerhouse behind sexual vitality and bladder control. Ignore it and you'll feel the decline. Train it and you'll unlock strength most men don't even know they have. The choice is yours. But the truth is simple: stronger pelvic floor, stronger erections, stronger life. Here's something most people don't realize: stress doesn't just live in your mind. It lives in your body. And when it comes to men's sexual health, stress is one of the most powerful erection killers there is. In fact, research shows that chronic stress increases cortisol, the body's main stress hormone, which lowers testosterone and restricts blood flow. Put simply, stress literally steals the blood from your penis and sends it to your muscles for fight or flight. So if you've ever wondered why your erections are weaker when life feels overwhelming, the answer isn't a mystery, it's biology. Now think about how common this is. A tough day at work, financial pressures, relationship arguments, or even the constant digital overload of modern life. All of it stacks up. And while you might think, I'll just push through it, your body doesn't forget. Stress silently rewires your biology. Blood vessels tighten, heart rate rises, and your brain sends a clear message: survival first, pleasure later. But if later never comes, your erections pay the price. This is why so many men over 40, 50, and 60 notice that their problems in the bedroom often started during their most stressful years. Here's the hard truth. Most men try to fix erection problems with a quick pill, but they never address the root cause: chronic stress and tension. And even worse, they carry the shame of not performing, which only adds more anxiety, creating a vicious cycle. Performance anxiety becomes a self-fulfilling prophecy. You stress about getting an erection, which triggers more cortisol, which makes it even harder to get one. Sound familiar? It's not a lack of masculinity, it's a stress feedback loop. But here's the empowering part: you can break the cycle. And it starts with something as simple as relaxation. Breathwork, meditation, and even targeted pressure points can calm your nervous system, lower cortisol, and allow blood to flow naturally again. When you activate your body's relaxation response, you're literally telling your biology, it's safe to connect, it's safe to feel, it's safe to perform. This isn't just theory. Studies show that men who practice mindfulness and stress reduction techniques experience better erectile function, stronger desire, and improved satisfaction with their partners. Let's zoom in even further. Your erections are not just about the physical. They're deeply connected to emotional intimacy. When stress dominates, it builds walls between you and your partner. You may withdraw, avoid intimacy, or carry silent frustration. But when you learn to manage stress, you open the door to deeper connection. Imagine walking into the bedroom not weighed down by tension, but present, confident, and emotionally available. That shift doesn't just improve erections, it transforms relationships. Now, ask yourself what's holding you back from addressing stress head on. Is it pride? Is it the belief that real men don't meditate, or that relaxation is weakness? Those are myths that cost men their health and happiness. The truth is, strength isn't about grinding through stress. It's about mastering it. Because when you master stress, you don't just improve sexual performance, you improve every aspect of your life, your sleep, your focus, your energy, your mood. That's real power. Here's the contrast you need to see: neglect leads to burnout, weak erections, and strained relationships. But self-care, choosing relaxation, making time for breathwork, prioritizing recovery, leads to vitality, confidence, and stronger intimacy. Which side of that equation do you want to live on? Too often, men wait until their bodies break down before they act. They wait until a heart attack, until severe ED, until relationships are already damaged. But you don't have to wait for a crisis. You can take action now. Learn to breathe deeply, stretch daily, explore mindfulness, or even practice simple pressure point techniques that relax the nervous system and restore circulation. These small choices create massive shifts over time. So here's the mic drop truth: stress may be invisible, but its impact on your erections is undeniable. If you don't control it, it controls you. But the moment you choose relaxation over reactivity, self-care over silence, you unlock not just better erections, but a healthier, stronger, and more connected version of yourself. Here's a truth many men never hear: confidence and intimacy work together like chemistry, and when one is missing, the other almost always suffers. I've seen countless patients who come in worried about weak erections, low desire, or relationship struggles. And yes, the biology matters: testosterone, blood flow, nerve health. But what often gets overlooked is this: when you feel emotionally disconnected from your partner, your body responds with weaker erections. Intimacy is not just physical, it's deeply chemical, psychological, and relational. Let's start with the science. Sexual arousal is not just a switch in the brain, it's a complex interplay of hormones, neurotransmitters, and emotional states. When you feel connected, respected, and valued, your brain releases oxytocin and dopamine, neurochemicals that fuel desire and reinforce bonding. This state enhances testosterone's effects, supporting stronger erections. But when there's conflict, resentment, or silence between partners, stress hormones like cortisol rise instead, dampening desire and tightening blood vessels. That's why a man can have no trouble with erections when feeling loved and secure, but struggle when tension builds at home. It's not weakness, it's biology responding to emotion. But here's where so many men get stuck. They believe their erection problems are purely mechanical, something a pill or a supplement can fix. And while medications can help, they don't rebuild confidence, they don't repair communication, and they don't erase emotional distance. Too many men avoid hard conversations with their partners, thinking it's easier to just deal with it. But that silence doesn't just affect relationships. It affects physiology. Emotional disconnection becomes a physical problem. Now, here's the challenge: confidence in the bedroom starts long before you get there. It begins with self-respect, caring for your body, addressing your health, and being honest about your struggles. It continues with communication, telling your partner what you need, listening to what they need, and being open to vulnerability. Studies consistently show that couples who openly talk about sex not only report greater satisfaction, but also experience fewer erectile difficulties. Why? Because intimacy thrives on trust, and trust reduces stress, the number one erection killer. Let me ask you this: what's more powerful? A temporary fix that masks the problem, or building a foundation of confidence that transforms both your health and your relationship? The man who avoids conversation, who hides behind excuses, who lets shame dictate his actions, he suffers silently, his confidence shrinking day by day. But the man who faces the truth, who invests in his health, who opens up to his partner, he reclaims not just stronger erections, but a stronger sense of self. That's the real win. And let's not forget the flip side. Intimacy is not only about erections. For many partners, what matters most is presence, being there emotionally, showing affection, creating connection. When men equate intimacy solely with performance, they place enormous pressure on themselves, which only increases anxiety. But when intimacy is seen as shared experience, confidence grows, stress decreases, and performance naturally improves. This is why couples who cultivate emotional closeness often report more fulfilling sex lives, regardless of age. Here's the contrast: neglect your relationship, neglect your confidence, and you'll watch your sexual health decline. But nurture intimacy, communicate honestly, and prioritize self-care, and you'll find that erections improve, not because of magic, but because your body and mind are finally working together. Which path do you want? Silence and struggle, or connection and strength? Too many men wait until intimacy has eroded to seek help, but you don't have to wait for crisis. You can start today by checking in with yourself. Am I caring for my health? Am I confident in who I am? Am I being open with my partner? These small questions unlock enormous change. So here's the mic drop truth: erections don't just depend on blood flow. They depend on connection. Confidence without intimacy is fragile. Intimacy without confidence is incomplete. But when you combine both, you create the strongest foundation for sexual health, lasting relationships, and a more fulfilled life. Here's a truth many men don't want to face after 60, and your erections are no longer just about performance. They're about survival. That might sound dramatic, but science makes it clear. Erectile health is one of the earliest indicators of overall vascular health. If your erections are fading, it's often because your blood vessels are narrowing, your hormones are shifting, or your body is sending urgent signals that it needs care. What looks like just aging is actually a window into your heart, your brain, and your future. Let's break this down. Erections depend on three main systems working in harmony: blood flow, nerve function, and hormones. With age, arteries stiffen, testosterone levels decline, and nerve signaling slows. But here's the shocking part: erectile dysfunction can appear years before major cardiovascular disease shows up. In other words, your penis may know more about your heart than your doctor does. When you ignore changes in your sexual health, you're not just risking intimacy, you're risking your life. Now, let's get personal. I see so many men who feel embarrassed when they struggle in the bedroom. They avoid intimacy, avoid conversation, and sometimes even avoid their doctors. But hiding the problem doesn't make it go away. It only makes the health risks grow. The taboo around male sexual health has cost too many men their relationships, their confidence, and in some cases, their lives. Isn't it time we stopped treating this like a secret shame and started treating it like the medical issue it truly is? And here's where the psychology comes in. Sexual health isn't only physical. It's tied to self-worth, connection, and identity. When men lose confidence in their erections, they often lose confidence in themselves. They withdraw from their partners, creating distance in relationships that once felt close. But here's the empowering truth: this doesn't have to be your story. Because just as your body can decline with neglect, it can heal with care. Exercise, better nutrition, hormone evaluation, and medical treatments can dramatically improve both erectile function and long-term health. Let's talk lifestyle. Regular physical activity, especially strength training and aerobic exercise, improves circulation and boosts testosterone naturally. A Mediterranean-style diet protects blood vessels and reduces inflammation. Quality sleep helps regulate hormones, while limiting alcohol and quitting smoking restore vascular health. These aren't quick fixes. They're long-term investments in vitality. And the benefits go far beyond the bedroom. Stronger erections, sharper memory, better energy, a lower risk of stroke and heart disease, all connected to the same daily choices. But let's not ignore medical options. For men struggling despite lifestyle changes, treatments like PDE5 inhibitors, vacuum erection devices, or even penile implants can restore function and confidence. Testosterone therapy, when carefully prescribed, can also make a profound difference. And yet, too many men resist these solutions out of pride or fear, when in reality, seeking help is a sign of strength, not weakness. Because what's the alternative? Living in silence, letting your health decline, and losing the intimacy that keeps relationships alive. Here's the contrast you need to see. Neglect leads to frustration, isolation, and disease. But self-care leads to vitality, intimacy, and longevity. Which future do you want for yourself? The man who shrugs off his health ends up not only weaker in the bedroom, but weaker in life. The man who faces the truth, who seeks help, who invests in his well-being, he doesn't just live longer, he lives better. And this is the bigger picture after 60. Sexual health is no longer just about pleasure, it's about preserving independence, connection, and quality of life. Erections aren't the goal, they're the signal. The real goal is longevity, staying healthy enough to enjoy intimacy, relationships, and vitality for decades to come. So here's the mic drop truth: your erections are not just about sex. They're about survival, confidence, and connection. Ignore them, and you risk losing more than intimacy. Listen to them, act on them, and you gain not just stronger erections, but a longer, healthier, more fulfilling life.